Back now on Most Buffalo, and an upcoming free community health event is focusing on early detection and prevention, specifically when it comes to conditions that can lead to limb loss. This is part of a growing effort to reach people who may not have had regular access to care, while also building stronger connections between doctors and community resources. Joining us to tell us a little bit more about this upcoming screening event is Dr. Ben Zwerchowski with the Buffalo Medical Group and Andrew Wheeler, a wound care specialist at Ergo Medical. Thank you both for being here so much.
Thanks for having us.
This is part of a national organization called Save a Limb, Save a Life. So who can explain a little bit about what that mantra and the organization means?
Sure. It's like you said, it's nationwide, and really we're trying to raise awareness about how serious your skin care is, and if you are at risk for losing a limb because you may have diabetes or some other risk factors, peripheral artery disease, that can then lead to an amputation.
And this is going to be a free community health screening coming up this Saturday. Dr. Z, what are you going to be doing, and what can people experience?
So it's going to be a very thorough evaluation of people who may have loss of medical care within the community. We'll be doing everything such as blood pressure checks, doing basic heart exams, we'll be doing a balance assessment led by my colleague Dr. Wheeler. We're going to have multiple medical doctors throughout the community, including myself, an interventional radiologist who does procedures that help reestablish blood flow in people who may have a medical condition such as high cholesterol or diabetes that has been previously diagnosed in the past, or they may be walking into the door this upcoming Saturday not even knowing that they may have one of these conditions. And it is our mission to help them understand what may be going on within their body before it presents with a complication such as losing a foot, where they may end up being admitted to a hospital when first learning that they have one of these conditions in the first place.
And do you think that enough people realize that living with a condition like this can lead to the loss of a limb, the potential for that? Unfortunately,
I don't think enough people realize that. They might be walking around now with a non-healing sore, and we'd love to see those people too. They're obviously at risk for losing a limb if they already have a sore, but we also want to talk about those risk factors that they just might not know about.
And what are some of those risk factors?
So if you have a diagnosis of diabetes, that is an extreme risk factor. If you have any heart condition or peripheral artery disease, that's also a risk factor. Many folks lose sensation in their feet and in their lower limbs, and you could injure yourself and not even know. And so that could definitely lead to worse things. And I imagine if someone is in one of these positions, maybe they have had some care for this before, but maybe there's been a lapse, or they just have a question that they really want to get checked out right now, and this would be a good opportunity for them, right?
Absolutely. We have a full breadth of medical specialists throughout the community who have been so excited about getting involved with this organization, because it gives them the opportunity to reach people who don't necessarily know how to go about even doing something as putting on appropriate footwear for their medication, putting on appropriate lotions to hydrate their feet, taking their medications appropriately, where we are able to give them an opportunity to ask the appropriate questions to people who are not only well educated but passionate about doing these kind of things. And as a primary care physician, one of my passions is bringing the community together to tell people these are the things you have to watch out for when it comes to maintaining your health, so we can cut things off of the past, so to speak, before simple medical problems can turn into very complicated ones.
Again, this is a screening called Save a Leg, Save a Life. It's happening this weekend at Gerard Place. What are all the details?
So the event's going to be starting at 9 a.m., running through 12 p.m. We are hoping that we will get at least 100 attendees through the doors to this event, and there is a free meal at the end of the event that will be provided to each patient who comes through the door, and we'll also be providing a pair of Bombas, a special type of support sock, to reinforce the message of taking good care of your feet. And from the time that you walk in the door, you will be getting attention when it comes to things as trying to get linked with a primary care medical provider, from the time leaving through the door around noon, of how can you go about navigating throughout the community, getting established with a doctor, seeing a physical therapist, so you will get as much information as you can about going forward to preserve the health of your legs in the long run.
Again, 9 to 2, this is taking place at Gerard Place in Buffalo. Do people need to sign up or they can just walk right in the door?
They can just walk right in. We encourage people to bring maybe caregivers with them if they're comfortable with that, or loved ones. Just sometimes it helps to process the information if you have somebody with you, but they can be there on their own and walk right in.
All right.
You do not need health insurance in order to come through. We will see the insured, we will see the non-insured, we'll see people who are on Medicaid, Medicare, and we will also be having a local insurance group to help navigate what the process looks like for seeking out health insurance in the event that you come to the door non-insured on the day of the event.
Drs. Zurchowski and Wheeler, thank you so much for being here on Most Buffalo, and good luck with the event this weekend.
Thank
Thank
so
you.
much, Lauren.